Hi, I'm Art Caplan at the Division of Medical Ethics at NYU Grossman School of Medicine in New York City. And thanks, Brochure, for asking me to comment on political changes in the US and what they mean for bioethics. And I'm going to sadly have to report that they don't mean anything good. I think a period of real challenge, a period of finding ourselves under scrutiny and maybe even attack by people coming into the new administration under Trump is going to pose challenges for American bioethics. Now, it's interesting, there was a recent survey done, published in the American Journal of Bioethics in September by Pearson, Gilbert, and colleagues. And they actually took a snapshot of what bioethics looks like in the US. And they found that surveying at bioethics centers and bioethicists who showed up at the ASBH meeting, that in important ways, bioethicists' views are not aligned with those of the majority of the United States public. They're more likely to think, for example, that abortion ought to be ethically available, less likely to believe that you should pay for organ donation. The field is less diverse than the American population, still skewing male and white, and that there are a number of areas, say, attitudes about end of life care and medically assisted dying, where again, there seems to be a gap. I think that survey is very important, but we now are in a situation with a new administration coming in that those differences are now reflected in the election. And appointments are coming at our health agencies in the federal government, HHS, CDC, FDA, USDA, EPA, and many others, where strongly make America great again, make America healthy again bureaucrats, RFK Jr., perhaps, Dr. Oz, perhaps, Joe Lombardo, former Surgeon General in Florida, going to be taking over. And these are people who are not committed to evidence-based medicine. They are not committed to the view that serious health reform in terms of granting access is an important priority in the US. They want to cut costs, not necessarily expand access. And some of them are hostile to bioethics, just flat out hostile. They think of it as where the liberals are. And if the survey that was done by Pearson is true, it probably is correct that American bioethics does skew progressive, does skew to the left. So, what is the reality of where we're going? It isn't just to talk more about trying to diversify the field of bioethics at centers and programs in the US and elsewhere. That's fine, and I don't oppose it. And we really should take diversity seriously, including disability, people who are older, people who come from rural backgrounds. We do need more voices from international sources, different religious points of view. We need more diversity in many, many dimensions, but that is not where the battle is going to be. That's our own internal battle. In my view, we have to get ready in the US for situations where prosecutors are fishing with subpoenas to find out about money that they might say is misspent or not really what the American people want in our programs like ELSI, where we've had many, many different studies about the ethics of chimeras or the ethics of genetic engineering. I'm not sure how well that's going to go over in the new administration, in the new NIH. I'm not even sure what the budget is going to be for bioethics in the new NIH. It could be trimmed back. I absolutely believe the budget for different types of research overall in science and medicine is going to be either cut back or reoriented away from justice concerns, away from diversity concerns, also away from areas like gain of function research, usually controversial, infectious diseases and vaccines. A lot of these people coming in are not enthusiastic about those, and public health in general. That means belt tightening across the board. I think that's going to impact us. I'd be very leery to be practical about funding things where I wasn't sure I had longer term funds available, not relying on the promise of getting a grant renewal or the promise of getting a new grant. I think we have to be careful and cautious. I think you have to be careful and cautious about your records, what you may have in terms of talking about things like transgender issues. Somebody could come after those and, really make life difficult for someone who's been outspoken in defense of that area, of that particular, of the issues that surround that area. So I worry that we're going to see less funding, pressure, trying to see where there's quote unquote waste in what bioethicists do, less attention to what the bioethics field has to say. My solutions, we're going to have to speak up even more loudly. I don't think the right answer is to do what the National Academy of Sciences head recently said, which is we're neutral, we're value free, we just do our work in science, basically saying, leave us alone, we're not political. I don't think that's the answer. I think that we have to be loud, advocacy oriented, make sure that the work we do just doesn't sit in journals. We have to find allies and friends in the US at the state level, in the private sector, maybe even with industry, and people around the world who are willing to help broadcast what we believe to be sound ethical reasoning about topics. We may not all agree, and there certainly can be a defense, even of some of the MAGA and conservative positions, but I don't think we should retreat. I think we may not be able to grow in terms of numbers. I think it may be a reality that the ability to advance and promote slows down, but that doesn't mean the work that's getting done shouldn't be oriented toward the practical, toward the political, toward making a difference in fighting back when we're faced with gibberish, quackery, goop, non-evidence-based thinking, and sometimes just flat out hostility to the idea that, say, women ought to be in control of their reproductive decisions. So sorry to have to, as they say in medicine, hang crepe. Not fun to give a negative diagnosis about where we're going, but I think it's going to be a rocky ride for the next couple of years. And I think we better prepare ourselves for that by working closely together with one another to support one another. Thanks.